Hello and welcome to the Dare to Differentiate podcast. This is Chani, your host, and I'm very excited for our guest today, Dr. Zvi Goldberg, acupuncturist. Are you also a rabbi?
Yes.
Yeah? Okay. Herbalist. Do you want to do a little intro for us?
That's about it.
That's about it? I mean, that's very modest of you to say that's it, but okay. We'll just pretend. That. Yeah, we'll just go with that, exactly. Do you want to start by telling us how you got into acupuncture? Is that a good place to start? Okay.
Yeah, it's a very good question. Everyone's always asking me that question. I don't have one particular story, I guess, reason what got me into there. Like, speak to lots of acupuncturists, and they always have like, there's this one story that happened, and they fell in love with acupuncture. For me, my interest started when I was a little boy. It kind of just interested me, just putting needles in one part of the body to help other parts of the body, which is pretty cool. I think there was also a story with my mom. She had really bad sciatica. Mm-hmm. She's a nurse, and a friend of hers, which is also a nurse, I think lived in Asia or came from China, and she did some sort of acupuncture treatment where she took like the back of a pen and did more like acupressure on my mother's ear. So I guess growing up, and it helped sciatica. The sciatica went away after her doing it one night. So I guess I grew up with that story in my head. So it was something that I knew works and wanted to know more.
Wow, that's really interesting.
I kind of knew sort of I was going to be in the medical field or wanted to be. Mm-hmm. Then I got older. I remember I was researching, trying to figure out like how it works, what it's good for. When I was on Google, and Google you could find all sorts of things, true or not, you don't know.
Yeah.
So I'm like, you know what? Let's just go to school for it. This way I'll get all the right answers.
Right. What was one thing once you started learning about it that like surprised you about acupuncture? Or you kind of knew what to expect? That's
a good question. I guess what surprised me is everything it could treat. I knew it could help with pain. And that was about it I knew. Actually, I remember going into acupuncture school. I was like, okay, I'm going to go in. I was debating actually between acupuncture and PT school because I wanted to help people with pain. When I decided with acupuncture, I'm so happy I did because it could treat so much more than just pain. Mm-hmm. But when I got there, I remember my interview, the person that was giving me the interview was like, it could treat more than just pain. And I'm like, oh, I didn't know that. Right. And she's like, yeah, it's pretty much a medicine on its own, and it could treat pretty much anything. It's not a cure-all for everything, but it can treat everything. So
what's the difference? A treat-all and a cure-all?
Cure-all is nothing out there is a cure-all.
Right.
Anyone that says this is a cure-all, you want to run.
Right.
But it can help treat things. So there are things that it can treat and it can be very helpful for, such as pain, women's health. And then there are things that it could be helpful for, but it's better to do alongside, let's say, Western medicine. I mean, in general, acupuncture, you do want to do it alongside. You don't want to just completely not go to your doctor. But there are things like, for instance, pain. Acupuncture can do a lot more with pain than, let's say, Western medicine. Western medicine, the option is pills, which is more of a Band-Aid, whereas acupuncture could help get you out of pain and not needing to take pills for the rest of your life. Like, if someone needs surgery, acupuncture is not going to magically cut out whatever needs to be cut out, right? But it can be helpful for pre-surgery, helping you, and then post-surgery to help you recover from the surgery. So that's what I mean, like alongside Western medicine. I think more for emergency kind of the things it's not as helpful for. At least they don't teach us in
emergency
medicine, like someone needs to go to the ER, something emergency that needs to happen ASAP.
So if like bleeding or heart failure, stuff like that.
Things like that.
You mentioned women's health. Can we talk about that?
Yeah, women's health. Let's see, where do we start from? So anything related to someone's period, for instance, painful period, not having a period, very little bleeding, too much bleeding, mood swings, headaches, anything that's related to your period, acupuncture can be very helpful for. Whereas Western medicine, they give you the only really treatment for anything going wrong with your period is birth control. That, or they say just take a Tylenol and live with it. It's normal. That's what they say, right? It's normal to have pain when you're on your period. Suck it up or take some medicine and you're good to go. Where acupuncture believes that a period should not disturb any part of your day-to-day life. So you should not be in any pain, you should not be having headaches, you should not be getting cramps. And if you are, then you can get that treated, and then you should not be having pain, should not be having headaches, should not be having heavy bleeding or too light bleeding.
Can you say that again for everybody to hear?
Starting from where?
No. That you should not be having pain. You should not be in pain on your period. I feel like
pain is not, I know it became normalized.
Culturally, it's very normal.
So I talk about common versus normal, I guess. Common, yes, it's very common for women to have pain on their period, but it's not the norm. Even though people might normalize it, it's not normal, and you do not have to live with pain while you're on your period.
Right. So what kind of treatment? Like, can you talk about the treatment? Is there like a one type of treatment? Is there several? Is it depending on like what that?
In Chinese medicine, we don't go based on, let's say, a Western diagnosis, right? Someone comes in for dysmenorrhea. It's not going to be the same treatment for every person. In Chinese medicine, we try to find a pattern why you are experiencing this pain, or why you're experiencing mood swings, or why you're experiencing headaches. And based on what we find, we either, as an acupuncturist and an herbalist, I'll do acupuncture, right? So we pick some points based on the pattern that you present with, and we try to address that. And then we could also we prescribe herbs the same way. We find a pattern, what's causing your condition, so to speak, or your pain, and through the herbs and through the acupuncture, we help address that to help the body do what it's supposed to do and normalize itself.
So can you talk about the patterns? What does that mean?
Talk about the patterns.
Is it like complex?
So,
I'm sure it's complex.
Patterns, the same way you get a diagnosis from a doctor,
Mm-hmm.
Chinese medicine looks at it more. So, for instance, someone that has a painful period, right? You'd be diagnosed with dysmenorrhea.
Which is
painful period.
Okay.
Right. Sorry. Dysmenorrhea, you go to the doctor and you have painful period. They diagnose you with dysmenorrhea, tell you to take Tylenol or birth control, and they send you out the door. So, this goes for anything in Chinese medicine. Anyone that, let's say, for dysmenorrhea, or someone that comes in with the flu, or someone that comes in with any sort of Western diagnosis, you could have 10 people with the same Western diagnosis, and they all have 10 different patterns based on how we assess and we diagnose. And then the same thing, you could have 10 people coming in with 10 different Western diagnoses and pretty much have the same Chinese medicine pattern. So the treatment will sort of be the same. Obviously a little different because they're coming in for different things, but the core treatment will be the same. It's just trying to harmonize their pattern to function properly again.
I think one of the reasons why I wanted you to come on was because I've lived in this culture, and I know like how it's just normal to have pain when you're on your period, or other different types of, headaches or whatever that are just like totally normal, neck pain, back pain, like a lot of things are just normal. Normalize, just suck it up, whatever. First of all, why is pain not necessary?
Well, it's not that pain's not necessary, but pain shouldn't be. When you're in pain, it's your body's cry for help. Okay, so it is okay to feel pain, right? We're human beings. We're not always living optimal. Things will go wrong. So it's okay to experience pain, and it's good to experience pain. It helps your body learn and build and be stronger. It's not okay to have pain that persists and stays. So if you have your period, and you have, out of all the periods in your life, you had one period that was painful, that's okay.
Mm-hmm.
If you have every single period, you have pain. I have people that come to me, they have pain where they can't function for 2 days straight. They have to go to bed, and that's it. They're 2 days a month. They are in bed, not doing anything.
Mm-hmm.
That's not okay. Saying take birth control or Tylenol and hope for the best is not a solution. Saying that's normal, women go through it, is not a solution.
Mm-hmm. So what is the solution?
The solution is to get better now, or to not have pain. How do you do that? There's lots of ways to do that. First and foremost, acupuncture.
Right.
I might be a little biased on that.
Shameless plug away.
But there's diet. Diet can play a massive role in someone's pain tolerance or pain experience. Exercise, hydration, these are all things that play a role in pain you're experiencing and how intense the pain that you're experiencing will be. right? So if someone has pain, this is not really, yeah, so let's say someone has pain, okay? Then they get a bad night's sleep. The next morning, their pain will probably be a little more intense. It's not that the pain is more intense, it's your body's experiencing the pain more intensely because you don't have the capacity to handle that because you got less sleep. So then it becomes this never-ending circle because you're in pain, so you can't sleep, and then you don't get sleep, so the pain's more severe, and then you're just in this circle of going no sleep, more pain, no sleep, and it goes on and on. So you kind of need to break that pattern any way you want to do it, whether it's acupuncture, diet. It depends what the pain's coming from, but there's solutions for everything. I guess one of the hardest parts to know is where to go, where to turn to. And it can be frightening, especially when you've gone to so many people and they all said either live with it or there's nothing we could do. For the most part, there's always something that can make it better, right? So not everything is going to be for sure curable, so to speak, but there's always something to do to make whatever you're experiencing better and less intense, less severe.
More comfortable.
So you could function better.
And just knowing that there is help out there.
Yes. So that was something I always wanted to do, was just let people know that there's hope.
Yeah.
Right. And even just that in itself, people knowing that there's hope is helpful in itself. So.
Yeah, I guess which like brings this conversation to maybe something else. This whole idea of like psychosomatic, like the reality that our mind and body are so connected. And so as soon as there is like a level of hope, then that's like the first step to finding healing in your body as well.
Yes, I mean,
and then so that's just like my personal reading of it, and I'd love to hear your thoughts. And then I would also love to hear your thoughts on in general, like the mind body.
So,
yeah,
pain's a very tricky subject because everyone experiences pain differently, right? If you could measure, there's no way to do this, but if you could measure how much, let's say, a sprained ankle, the pain is, right, for a sprained ankle. Two people could have, let's say, the same, I'm doing air quotes, you can't see, the same.
Next time you come on, we'll have the cameraman.
Could have the same, so to speak, severity of pain, but one person will describe it as a 2 out of 10, and someone else will describe it as a 10 out of 10. People will say, oh, I have a high tolerance of pain. I mean, yes, there are people that have higher tolerance and lower tolerances, but it also has to do with your state of mind, sleep, nutrition, hydration, and if you experienced that pain before or not. So there's lots of research now into like chronic pain. There's, I forgot the name of the doctor, but he gives a really cool example on a TED Talk. I'll give it to you after. I'll find it for you after. But
link it in the show notes.
Yeah, he's explaining pain, and what happened was he was once walking. What's the word? I'm gonna
quote you.
I'm gonna butcher it up, but I'm gonna try to say what he says. Right. So he's walking in the forest. He's going on a hike, and he feels this branch on his knee, on his ankle. Right. And he goes, "Oh, what was that?" He goes, "Oh, that was just a branch on my ankle." He brushes away and he keeps walking. Right, because the branch doesn't hurt you. Right. And one day he was on the beach and he felt this little branch on his ankle. And he's like, oh, it's just a branch on my ankle. It's not a big deal. And then the next thing he knows, he wakes up in the hospital because he got bit by a stingray. Right? So that sent him to the hospital. He woke up 3 days later or wherever it was. Then the next time he was walking in the forest, going on a hike, right? The same branch touched his ankle. He jumped and screamed with pain. But a branch doesn't hurt right before it. He just brushed it off. So why did he do that? Because his brain felt that branch. And it's like, last time we felt that, we ended up in the hospital for 2 days. So it must be really painful. So he felt this enormous pain when really was just a little scratch. So there is this aspect of pain's in the mind. It is, but it also doesn't mean you're not feeling it. It's a both, right? Your body's experiencing pain, and it's not like, oh, it's just in your head. Just think it's good and you'll be okay. But also the mind does play tricks, and it is so pain is very tricky.
Is that like a trauma response?
So yeah, in a way, right? So the last time he felt that kind of scratch on his ankle, his it was a bite from a stingray and he was in the hospital. So his mind right away was like, let's protect you. That must be really painful. Pull away, scream, because the last time we ended up in the hospital. Mm-hmm. So it does play on with trauma, yeah.
You want to talk about that?
Not right now. Not today.
No. Okay.
Another time.
No, that's fine. Okay. Okay, so that's why we need something to get people to come back and listen next time, right? I guess the first point to know that it's not necessary to be in pain.
Yes.
And maybe you need to say that again. I don't know. I think there's just like also like a lot of unlearning. And I think there's also a lot of, I guess, like fear or discomfort or like unknown with alternative medicine, any type of alternative medicine that people are not necessarily so familiar with. So how do you encourage, like, I guess, like, how do you deal with that? How do you deal with like people being iffy about this type of treatment?
It's difficult.
I'm sure you have a lot of stories.
People, yeah. So firstly, I never try to convince someone to come get acupuncture, right? If someone's not interested, or, I mean, while I was in school, everyone I saw, I'm like, you have to go to acupuncture. This is happening. We could help. We could help, right?
Right.
And then I've got a lot of resistance saying, oh, that's BS. That's not true. It's magic. I'm like,
right.
Okay. And then I would get into this whole debate with them. But now it's more, there are people who, let's just say, don't want help, unfortunately, or think they know best, and trying to convince everybody that this is the way to go is going to be impossible. So people, I use my social media to try to educate people and let them know that, hey, what you're experiencing is not normal. What you're experiencing, you can be helped. There are things out there that could help you, right? So I've done some posts about women's health. Like I did like a common versus normal post, right? So I think it was more of a postpartum, right? So I did a whole post about common versus normal, right? But the point of it was to educate people, because people don't even know what's considered, what can be helped, or like, oh, this is the rest of my life, right? So period pain, for instance, people are like, okay, they went to their doctor said, this is how it's going to be. So like, okay, good. This is how it's going to be, and I'll just live with it. They don't know there's another option. They're like, oh, you might not have to have a period or not have pain while you're on your period, right? So educating people, if I hear people talking about it, rarely do. But if I hear people talking about it, I let them know, like, hey, there are solutions out there. And then you let them make the choice. Because you can't force treatment upon somebody. It needs to be, they need to want it, so to speak.
Do you feel like people need to want it more than other type of treatment? Or
No. So people, the first, I guess the second thing people tell me after I tell them I'm an acupuncturist, so they're saying it's BS and magic. It's just placebo.
Right.
So that goes back into the whole mind kind of thing. So acupuncture is definitely not placebo. If you believe in the treatment and you believe it's going to help you, great. It's going to help you even more, because if you believe in something, your mind's going to, right? So pain, if you believe that you're not in that much pain, the pain will be less. So if you believe in the treatment, it's going to help you more. If you don't believe in the treatment's still going to work. It might not be as effective because you're kind of fighting against your brain, but it'll still work. So there's something called a nocebo too, where it's the exact opposite of a placebo, right? Placebo, things work even though it's a water pill, so it's not actually supposed to help anything, and because you thought it's going to help, it helps. So same thing's in nocebo, where you take the real medication and the effects are not the same because your mind completely doesn't believe it's going to work. So same thing with acupuncture. You don't have to believe in it to work, but if you believe it's not going to work, the results will be less.
Right. Well, I also feel like with acupuncture, for a lot of people, it's a last resort. once it's a last resort, there's probably a lot more.
Yes. So a lot of alternative treatment, like you said, like acupuncture, it's usually last resort. A lot of patients come to me, I tried everything and now I'm here. I want to be fixing one treatment. Right. It's like, think about that. No one else is able to help you, and you're expecting one acupuncture needle to just make everything go away. Mm-hmm. So no, that's not going to happen, unfortunately. I'm still working on getting that magic needle, but I haven't found it yet.
So how do you talk to your patients about that? Because
I
that's probably a hard conversation to have.
Yes, it's definitely a difficult conversation to have. I actually, on my intake form, I don't know if you know, I have a questionnaire, a question just to kind of help gauge where it's how invested are you in getting help and getting better. Scale 1 to 10, how invested are you in getting better? It's kind of shocking to see how many people don't put 10.
What do they put usually?
Put 5, they put 7, they put 3. And I'm like, okay, if you're
believe
not invested in getting better, like, I guess this is Western medicine. It's more like you don't do anything. You come to me, we either give you a medicine and you could go back to your day and either it'll help or won't help. We do an operation, we do surgery, we cut something out, we put something in, and you don't really have to put in that much work, right? It's when it comes to alternative medicine or to actually fix what's going on, you need to put in all the work. So acupuncture is not curing you. It's helping your body do what it's supposed to do. Our bodies are meant and is able to fix us, so to speak, cure whatever is going on with our body. It can help that. Sometimes our body gets stuck or gets caught in this loop where it's forgetting or it's trying to do so many other things, so it doesn't get rid of your pain you're experiencing, or it doesn't know, or it's stuck trying to figure out how to do that. So the acupuncture herbs is kind of helping your body do what it's supposed to do.
Right.
So yes, that's going to take longer than take a pill. Or, I mean, even surgery. Like, it's not like you're better after surgery, right? People are like, oh, I'm just going to go for my knee surgery and then I'll be better. It's like, no, you won't be better. You still have 6 weeks to 6 months of PT that you have to do. Otherwise, you're going to be just in as much pain. And people don't talk about how it's not always guaranteed. I mean, like, I see all the people, all the fails, right? Everyone that comes to me is like, oh, I just went for knee surgery and it didn't help. I'm like, yeah, especially if you're going for like something where the first treatment is actually PT or acupuncture, but you chose, like, you thought it would be easy, I'll just go get it cut out and I'm good to go, because we're not into doing work in America for our bodies. We're good at working other things, but for our bodies, like, give me the quick fix and I'm good to go. Give me Tylenol and I'm good to go. But to get better, it does take work. You need to put in the work for it. So sorry.
Yeah. Well, it must be like really hard to be a practitioner in this culture where people want things handed to them and you can't hand certain things to them.
Yeah.
That must be really difficult.
I try to have that conversation at first with my patients. So one of the things I try to do with my patients is educate them on how you will, like, what to expect. It's not a one-time thing. Because a lot of times people stop going for treatment and it's not the patient's fault they stop going. It's the practitioner's fault for not telling them what to expect or what it's going to be. Like, they're like, I get people tell me, oh, I tried PT 3 times and I'm still in pain. Or I tried acupuncture 4 times and it didn't work for me. I'm like, you tried it 5 times. Of course it didn't work for you. Try going to the gym 5 times and coming out with a beach body. It's not going to happen, right? Try dieting for 5 days and see how much weight you lose, right? Or try doing anything for 5 days. Try taking antibiotics for 5 days for your flu and see if you get better. You won't.
Z-Pack is 5 days though.
What?
I said Z-Pack is 5 days though.
But that's the pre. Try taking anything for half the amount of time you're supposed to take it and then see if you get better. So I always tell my patients, it's not a one-time treatment. It's going to take a while. Acupuncture is also, because it's natural, right? It's not nothing. We're not forcing anything upon you. It's going to be subtle, right? Yeah, there are stories, just kind of bad advertisement for acupuncturists, where there's stories like, oh, I had terrible back pain, 1 treatment, I was good to go. And that's great. I love when that happens. I just had a patient that happened to. He sprained his ankle twice, and I gave him 1 treatment, and the next morning he was fine. But for the most part, that doesn't happen.
Do you not want him to tell anyone? Do you not want him to tell anyone?
For the most part, especially when it's been going on for such. So also with him, he sprained his ankle. The next day he came to me.
Right.
So that's the importance of coming right away. If he would have waited 3 weeks and it turned chronic, it wouldn't be better after 1 treatment. So
what does chronic mean?
Chronic is long lasting.
Long lasting, as in
acute pain is, well, there's different ranges, but say first 4 weeks or 2 weeks to 4 weeks is acute. So the beginning of something's more acute, and chronic is when it's lasting for more than Depends. People say 4 weeks, people say 6 weeks. Depends.
If he would have walked in it for a couple weeks and then come to you, then it would probably be a different story. It's basically what you're saying.
Yes. I mean, also, right, so if he didn't come to me, right, who knows? Maybe he could have woken up the next morning and
It would have been fine.
We don't know for sure, but the way he was walking when he came to me, probably unlikely that that's what would have happened. But yeah, there are stories where people have, so like this thing, like with like, let's say frozen shoulder, for instance, right? Frozen shoulder without any treatment whatsoever. Like there are things that just go away on its own, right? But why wait for it to hope for it to go away on its own when you could do things to definitely make it go away faster and
Better user experience.
Yeah. Also, if it goes away on its own, do you fix what the cause was? Like you might, a year later, it might pop back up again, or you might get on your other. So, okay, back to your question. So I try to tell patients, listen, acupuncture, don't expect that tomorrow you're going to wake up and you'll feel fine again, right? Look for subtle changes. Oftentimes with acupuncture, it's like, oh, it's not working, it's not working, it's not working. You come back, you look back a month, like, wait a second, my pain's not as bad. I don't have headaches anymore. I'm only getting a headache once a week instead of 4 times a week. Oh, I don't have to, the Advil's actually helping now for my headaches, when before it wasn't helping my migraines at all. So the change is often subtle and hard to tell. So I also tell, like, it's very important, I think, for me to tell patients what to expect and what to look for. Because when it comes to pain, for instance, our bodies is very good at forgetting how severe the pain is, which is a blessing because otherwise we wouldn't do anything.
Right. Isn't that why like women have to bring carbon after they have a child?
Yes, because they swear they'll never have it again, and then they do it again. So, right. So let's say someone comes to me with pain, and they're getting pain where they say it's a 9 out of 10, right? 3 weeks later, you ask them how. You say, how's it going? I'm still in pain. It's not working. I'm still in pain. Okay, hold on. How severe is the pain now? Is it still a 9 out of 10 or is it went down? Oh, well, now that you say it, I can actually bend down and put my shoe on where before I couldn't. Right. Oh, I could actually get something from, like, I could sit and I don't feel pain. I could I could drive a car for an hour and I don't feel pain. If I drive for 2 hours, I feel pain, right? It's like, wait a second. So you're getting better, right? But in their mind, it's like, I'm still in pain. I'm not better. This is not working. So it's important to let people know that what to expect, so to speak. Right? So yes, you're in pain, but if it's getting better, it's improving. If your range of motion is improving, that means we're getting somewhere. Something is changing. If you couldn't lift your arm past 90 degrees because it was in pain, and now you can lift it more, and yes, you're still in the same amount of pain, but you gained 10 degrees of range of motion, that means you're getting better. So people have a hard time seeing that they're getting better because they're still in pain or they're still experiencing whatever they came in for. So I try to tell my patients, don't wake up tomorrow and expect everything to be gone. Look for subtle changes. Sometimes it's easier to see subtle changes when you wait like a month and look back. Say, oh, wait a second, I could do so many things I wasn't able to do before. So those are kind of ways to help people realize that they're getting better.
Yeah, well, it's interesting because from my experience, I almost feel like my standard for pain changed. So it's like certain pain I was like okay with, and then like once I started going acupuncture, I was just like, nope, like this is, then all of a sudden like the goalpost keeps changing.
Yes.
So that's like a whole other problem, which I think we can fix, but.
Yeah, so I mean, people come to me in terrible pain and they've tried everything and this is the last resort and they're convinced they're going to be in pain for the rest of their life. And I say, listen, definitely this amount of pain we could have an effect on, right? And let's start with there and see how that goes. Because even acupuncture is not guaranteed. Nothing's guaranteed. There are people that acupuncture doesn't work for at all. There's a small percent of the population that it doesn't really do much to act for some reason.
And how fast can you like determine that?
If it's working or not?
Yeah, like those people, how can you like identify those people?
So I usually, if I'm giving somebody acupuncture and there's absolutely no change after 3 treatments, I will either one completely change. Well, truth is, if one, well, let's say 3 treatments. If there's no change whatsoever, I either will tell them that this is not for you, or I will definitely. I mean, usually I'll let them know like, hey, what we're doing right now is not working. All right, let's try another approach. And are you down to try another approach, or you're done with trying? That's usually what I'll go with.
Or would you recommend another practitioner?
Yeah, I mean, I always, all my patients, I tell them, anyone that comes, I'm like, listen, acupuncture is great, but okay, so it's not. Yes, I do recommend people to go other places. Depends what they need, what their needs are for, what I can give them and what I can't give them. But so I always get the question, what's better for me? Should I go for acupuncture? Should I go for chiropractic? Should I go to PT? This is in terms of just like
physical pain.
PT, physical therapy.
Yeah,
right?
I'm saying physical pain.
Physical pain, yes.
Right.
Let's talk about physical pain. So I say it's not about is acupuncture better, is physical therapy better, is chiropractic better, is taking Advil. It's more that you need to find a practitioner that you can vibe with, because it's all we all do pretty similar things. So yes, I do. The majority of my work is with needles, but I'll do body work. I'll teach people exercises. A PT's majority of their work is exercise, but they also do manual therapy. Chiropractic the same way. A lot of them do manual therapy. A lot of them teach exercise. So a lot of our stuff overlaps. So it's more about finding somebody that you can vibe with, because pain is a lot to do with the brain, the mind, and how you experience it. So if you have a practitioner that creeps you out, has terrible bedside manner, yeah, run. Even if he's officially the best acupuncturist in the world, I wouldn't go to him, because you'll have a terrible experience.
Right.
If somebody's so-so, but you get along and you can vibe with him and he makes you feel safe and he makes you calmer, then I would pick that person. Acupuncture, PT, chiropractor, whatever.
Right. Doctor. I guess the reason why I asked that question before, how fast can you identify if acupuncture is not going to work for someone? And you said 3 times, so I feel like that's...
I kind of give, if at 3 treatments there's no change, I make something's up, and either I completely miss a diagnosis, which happens, I'm human, or it might not work for you. Right.
Do you try to re-diagnose, or depends if they want?
It's up to the patient. Right. I used to try to convince everyone to come for acupuncture, but I realized that's never going to happen. So now it's like, this can be really helpful for you. I would recommend you come, but if you're not interested, then don't come.
Right.
Sorry.
Yeah, no, I think it's really valuable to be that kind of person that just respects people's choices and understands that everybody has their own experience, and this is an option. It's available to you. Right. You're more than welcome. Love to have you.
Yes, exactly. Come by. Like, I'll have people tell me, oh, acupuncture is terrible. I had a really bad experience with this acupuncturist. I said, okay, you had a bad experience with your acupuncturist, not with acupuncture. Right? Same thing. Even with doctors, right? Doctors get all this bad rep. They're terrible doctors.
Which there are,
sure. There are terrible. There are people in any profession that are terrible, and they suck, and they should not be doing what they do. If you're a doctor, and you have terrible bedside manners, you probably shouldn't be dealing with patients, right? Because they're coming to you, they're vulnerable. Let's say they're in pain. They're there for your help, and you're just being rude to them. That's not a way to go. And unfortunately, there are a lot of doctors who don't have great bedside manners, and that's why a lot of doctors get bad rep. But there are plenty of doctors that have great bedside manners, and they're excellent doctors. And you should definitely go see doctors. Right. That's my plug to doctors. I love doctors. There just are some who aren't very good. Right. Even if you are an acupuncturist, you still have doctors. So let's make that clear. My wife's the PA. My father-in-law's a doctor. My brother-in-law's a surgical resident. My mother's a nurse. My sister's a nurse. My brother-in-law is starting medical school. So yes, I'm a big fan of Western medicine. Right. So why did you not decide to go that route? Oh, I was not going to medical school. No, that's cool. Honestly, I didn't know how I would do in school. I thought it would be, I wasn't sure how I would do in school. When I was looking into acupuncture, like most people, I thought it was a 1-year program, a few classes on the weekends, I'll get a certificate. And then once I started looking into it, I'm like, wait a second, this is 4 years. I'm like, ooh, do I really want to do this? Do I have 4 years? Do I have 4 years of my life to spend in school. But the more I looked into it, I'm like, what the heck? Let's go for it. Jumped right in. One of the best decisions I made in my life. But it is 4 years. It's a master's / you get a master's out of school, and then I went for my doctorate in it. So
How long does that take? Doctorate.
The doctorate. So it's kind of funny because most master's programs are 2 years, I believe. Mm-hmm. For acupuncture, our master's degree is 3 years and 8 months or 4 years. So when it comes to,
but you also need like prereqs or like you need your bachelor's.
You don't need a bachelor's, depending on your school. So my school was either bachelor's or 60 college credits, I believe. But so the way it works is you get a bachelor's, master's, doctorate. Mm-hmm. Right? It's just an amount of how many hours in class you spent. So technically, our master's degree has enough hours to be considered a doctor or get your doctorate in that field. But it's not. So they added on 9 more classes for us to do more like clinical research, more like doctor level or doctor classes, so to speak, to get your doctorate. But we technically have those hours already, if that makes sense. So it was another year of school. For me, it was another 2 years, but it's another year of school to reach your doctorate.
So what kind of, you said clinical research, that's really interesting.
Yeah.
Clinical research for like Chinese medicine, I guess.
No, both.
Both.
Yeah, it's more how to find, it's for us to be able to, how to look up research, how to interpret research, how to know if it's a good research, not good, biased, not biased, things like that.
What kind of research is out there for Chinese medicine?
There's lots. We're getting better and better at research. There's a lot out there.
It's really cool.
It's a little difficult to do random controlled trials because acupuncture is very patient specific, right? Like I said before in the beginning, not everyone that has low back pain is going to get the same treatment. So when you take a room of 100 people that have low back pain and you do 50 of them fake needles, right? Sham acupuncture where you're not actually putting needles to the skin, and 50 of them you are putting in needles, and then you compare the two, they're all getting the exact same needles. They're getting the exact same, say, 5 needles in their back. So yeah, people that got real acupuncture might not get better because those weren't the points you should have given them. There was no exam. It was just, you have low back pain, you qualify. It wasn't like, wait, your low back pain is coming from your quads, or your low back pain is coming from your hamstrings, or coming from your glutes, or it was everyone gets the same protocol. It's the same 5 needles you get. So it's really hard to do, and that was what they called like the gold standard, right? Random controlled trials for research. So it's very difficult to get that when it's very patient specific. Mm-hmm. So now they're learning to do better research on how to see if acupuncture is working or not. I mean,
there's got to be another way to prove it, because even in Western medicine, like that kind of stuff, like just like they make a big deal about like it being really difficult to like study like pregnant women or stuff like that, like because of how varied the experience is or whatever. Somehow, I think there's got to be a way to figure out how to study.
The gold standard for research is random controlled trials, and that was made specifically to test if drugs work or not.
Right.
Right. Specifically, you take a group of 100 people that have headaches, you split them up 50-50. No one knows which 50 are getting the real pill, and no one knows which 50 are getting the water pill. And based on that, if the 50 people that got the real pill helped, and 50 people that got the water pill didn't help, we know it works. Mm-hmm. It's a great way to research pills and medication. It's not a good way to research when you're doing more patient-specific acupuncture, PT, chiropractic. It's not good. But for some reason, that's the gold standard.
Got it.
There are lots of fMRIs, which is they do an MRI of the brain, and they see different areas of the body of what lights. Well, they see what parts of the brain light up, right? So lots of times we put needles in certain places and it says, oh, like the hands or they're doing research for carpal tunnel. So when you have tingling in your hands, so different points that we used, the brain that's in charge of the wrist would light up and start being activated. So we know it has an effect. The question is how much. And they're getting better and better with research. It's just they're a little behind schedule.
Right. But I guess also pharmaceutical research is different than treatment research.
Right, it is.
So,
I mean, there's also what no one talks about when it comes to research is one of the biggest things we look at is doctors' experience on how they treat patients. So all of a sudden, when it comes to alternative medicine, no one talks about that, right? It's like, oh no, it's in the random controlled trial, it didn't work. It must be BS. It's like, wait, let's look at the 2,000 years of acupuncture and how it's been helpful. Like in Western medicine, we also believe doctors' experience. That's part of how we learn new things when a doctor's like, oh, wait a second, this is working on my patient. I don't know why it's working, but it's working. It's like, oh, it's BS. It's not true. No, it's like, wait a second, let's look into it more.
Right.
So now it's more like, we know acupuncture works. It's been going on for over 2,000 years. Now it's like, let's try to find out how it works and why it works so we could prove scientifically that it works. And they're doing that.
yeah.
And there's lots of research coming out with new things, and it's fantastic.
Do you want to get into it?
Research?
Yeah.
That is definitely not my area of expertise. It's really annoying.
It's not your thing.
No.
Listen,
That was the worst part of school.
the research.
It's
I
good to
get
do.
it.
It's good to know. It's good to be able to talk to doctors and show doctors, hey, listen, there's a study that shows acupuncture is successful. But that's like me and you. I don't care. Obviously I care, but for the most part, like my patients don't really care about what the studies show. They want to know if they're going to feel better or not feel better.
Right.
So I'm not that into research. I'm into research. We'll read it to see what helps, what doesn't help. But I'm also very much into like my patient's experience.
Do you have like a network of like acupuncturists that you like consult with, or?
Yeah, we have there are a few like acupuncture Facebook groups that I use a lot. I reach out to my colleagues sometimes. That's most of what I do. I have some professors, maybe one or two I'll still reach out to. It's usually Facebook. There's like groups and you could post your questions. People reach out to you. It's awesome.
You know what they say about reading things on Facebook, whatever.
Yes, that's right. So that's when you're getting answers from unqualified people, right? This is like, hey, have you ever experienced this, right? It's like, wait a second, you get 30 acupuncturists saying, oh my gosh, I just had that same thing happen to me. You're not crazy. This is normal. Like, it's like,
right.
Okay, cool. I didn't know that, right? Or have you tried this sort of treatment? This works for me. Have you tried this? Like, or, just
Right.
helping each other out.
Yeah, that's really cool. Facebook groups that are very cool.
I'm only on Facebook right now for the acupuncture
groups.
Facebook groups. They're fantastic. It's basically educational.
Right.
Well, it is educational. And
That's your research.
yeah, so like also, right. So I'll put, hey, anyone find any research on X, Y, and Z, and
Right.
I'll get 5 different articles about it instead of me having to search the internet for it.
And you don't know if it's a credible source or anything like that.
Right. Once they give me the link, it's published, and like it's easier to find than me having to spend and surf through everything that's out there. Basically, I'm lazy.
Right. The SEOs of the studies aren't great.
Yeah, no, not very good.
I'm curious if you have any advice for people, or like maybe just like a supportive statement of how they can educate themselves on what options are available and the types of questions to ask or the things to look out for when looking for treatment options. It's a big question, I know.
Difficult question to answer. So for me, like I'm trying to build a network of practitioners that I trust and believe in. So if my patient comes to me with questions, I can answer them. I can say, hey, try this, try that. Or I know this is helpful, this is not helpful. You can't really use the internet for that. Unfortunately, it's more you have to kind of find somebody that you trust, I think. Like speak to your doctor. Doctors usually have great referrals, not in terms of like alternative medicine, but more like if you need to get something done, like you speak to your doctor and hopefully they're not just sending you to their next person they know they've actually trust, and they would go to that doctor too, right? So I would only send people to someone I would go to, and not just hope for the best. But I mean, in terms of research for yourself, first and foremost, you want to make sure they're licensed, right? Right. Especially when it comes to acupuncture, or you just want to make sure they have a license to practice in that state. Second question that you could always ask is, have you ever treated this condition? I'm coming in with low back pain. Have you treated it? I mean, that's kind of common, but I've had people come in and I'm like, listen, I've never treated this before in my life. I know I can probably be helpful, but it's not, I can't guarantee anything. I've never done this before. If you're willing to give it a go, I'm willing to give it a go, and let's see what happens. But so you want to ask license, and then ask them, have they ever treated this before? And I mean, with today's, you go to Google and look up if they terrible bedside manner, they'll have 0 reviews on Google. But it's hard to know someone's bedside manner just by reading things up online, right? Or speaking with them on the phone, right? So, hey, yes, you're licensed. Yes, you've treated my condition. Then you'll have to go in and see if you vibe with that practitioner or not. Or you can find out. You can't really ask them, can I speak to some of your patients, because they can't give out that information. But if you know somebody that went there, you could go by yourself and say, hey, what's your experience with so-and-so? Right? Like my biggest advertisement is word of mouth. When one of my patients say, oh my gosh, you're feeling pain. I had pain too. Same thing. Go to Zvi. He's awesome. Thanks, guys.
Well, also when you listen to this podcast, you can.
Yeah.
Yeah. I guess it wasn't so much, the question wasn't so much about practitioners, but more just like the options of like types of treatments.
It's hard.
Yeah.
It's definitely very difficult.
Well, that's validating. So thank you.
It's very hard. And that's one of the things that make people feel alone. And also just they don't realize. I mean, so a good thing about Facebook, speaking of Facebook, is now there's all these groups. Like if any condition you have, you can find a group of people that have the same condition as you or going through the same struggle. And just be like, yes, what you're experiencing is normal, firstly. There are thousands of people that experience the same thing. So you're not alone. Yes, I got treated. This is what helped me. This is what helped somebody else, right? But it is hard if you don't know anybody to just, I'm still working on that, right? Like I'm sort of building a network so that I can help people. But anyone that asks me questions, I'm like, you don't have to come to me. Like, this is what's out there. There is help. But it's difficult to find.
Right.
Sorry. Still working on that.
What do you see that is there a way to make that easier?
I don't know. I think about that a lot, but haven't come up with a great solution.
I mean, conversations like this, so thank you for doing this.
Yeah.
I also feel like we don't plan our lives. Like we don't plan like who we'll meet and how we'll meet them and like stuff like that. And maybe it's just about trusting, like me trusting where I am, trusting that like the people who need to support me in my journey will find their way. I'll find my way to them. They'll find their way to me.
Yes. I mean, but it's also like you want to feel that's like trusting, right?
Yeah.
And that's important to trust, right? God has a plan, right? But sometimes as human beings, we want to know like, what can I do to make that better?
Yeah. To
like, as much as we know, right, God's running the world and he has a plan for us as human beings, we're still like, but if I do this, something will change, right? I have to do this because that's going to happen. I must do that. Where it's like, not really. I don't know if that was helpful. Yeah.
But also like back to your like question of like, how invested are you in your healing? How invested are you in getting to the other side?
Yeah. I have people that like will harass me with questions and they're all for it. They come for one treatment and I never hear from them again. I'm like, I know I didn't cure you from one treatment.
Right.
So a lot of people are very into starting, but are either afraid to continue, or some people unfortunately like where they are. Don't have to.
And the pain they're used to.
There's definitely the unknown, which is always scary for everybody.
Yeah. Wow. Any last thoughts that you want to share?
Last thoughts. I don't know. I think I got most of it out.
Yeah. Wow.
Maybe we'll come up with more questions another time. We'll get some other topics.
Yeah. I really would like to talk about, oh my gosh, I completely forgot.
What?
I wanted to talk about the nervous system, but that's a whole other conversation.
We kind of touched it a little bit. Yeah, no,
it's a whole other topic. That's like what I like to geek out on. Like, cool. Thank you so much for being here.
Yes, you're very welcome. Thanks for having me on.
Yeah, I know that your schedule is not very forgiving, but I think that this was a great conversation. And I guess just want to remind everyone that you don't need to be in pain. And there is like that choice that you have to make. And sometimes you have to make the choice more than once. Like choosing wellness over pain.
Yes. And it's a commitment and it's hard, but you don't have to be in pain and you don't have to suffer.
Yeah.
And there are solutions. You just have to ask.
Okay.
And it
Articulate the
can be a
questions.
journey, but it's important to experience the journey as well.
I like that. It's important to experience the journey. Want to talk about that a little more?
The journey? Well, so we could talk about like the nervous system. So pain, right? It sucks to feel pain, but you know what they say, like what doesn't kill you makes you stronger. So the pain that you experience does make you stronger.
Or it gives you a dark sense of humor.
Or it gives you a dark sense of humor, yes. But when you get out of that pain, then the dark sense of humor could go away and it makes you stronger. So yes, while you're on that journey, it sucks. And people often forget to, I mean, it's hard to appreciate when you're in 10 out of 10 pain your whole life, but breaking that circle of pain, terrible, miserable day, pain, terrible, miserable day, then you can start appreciating it and learning from it and having a more meaningful life and a more appreciation of your body, of how everything works and how the world works. If that makes sense.
Yeah.
Okay.
That's, I guess, life, like learning every day.
Yes, right?
Yeah. All right.
Trying to find the purpose.
So stay fabulous. Thanks for being here.
Thanks for having me. This was fun.
Yeah.
We'll do it again sometime.
Yes, definitely.